Namaskar everyone, and welcome you all for another episode of Revealing Burnett's Approach in Pathological Conditions. Today, what we are going to discuss about, we are going to talk about and discuss about case chapter number 15, where the case is all about Oophoritis. And it's a uterine fibroid case where there was inflammation of ovaries. And let us go and study more about this case. And I will try my level best to put my points, my understanding, what I have understood from this case. And there were some crucial pointers which I have understood and I would like to share with you. So let us directly go to the case and reveal it one step by step. So uterine fibroid case, this patient comes and it's chapter number 15. You can find it in Curability of Tumors by Medicine by Burnett. 1882, 11th February, an unmarried lady, 45 years of age, comes to her, suffering from fibrous tumor of the womb. Means what? The lady which comes, she has a tumor of like fibroid tumor, uterine fibroid tumor. General appearance was that of a lady at about 6 months of pregnancy. Means there was a lot of swelling. The swelling was so much, it was bulging. It looked like she's pregnant for 6 months. Tumor in the right wall of the womb. Left ovary very painful and enlarged a good deal. Is tender at menstrual period and most painful then. And no leukorrhea. So from this we understand that this is the case of tumor of fibroid uterine tumor. Along with that, there is inflammation on the left side, means the ovary is affected. Oophoritis is there. There is some inflammation of ovary, which every time when the menses comes, it gets aggravated. And she had no leukorrhea in her entire lifetime. Patient had a gouty tongue. Now this he writes down as a gouty tongue. And I could not understand this gouty tongue. I tried finding out at multiple places, how does gouty tongue look like and what is the meaning of gouty tongue. What I understood right now, it is very difficult to find even this term anywhere in Mater Medica also. Now, what does this mean? It means it is found out that there are some people who have got irritation in the tongue, maybe some ulcer, some irritation is there. And it has found out that this irritation, when persists for a long time, it has a direct connection with the altered kidney function. And when you do the kidney function test and you see the uric acid levels are high, kidneys are to wash out the waste products, which they are not able to do when the function of the kidney is altered. And in those conditions, many times it is found that these patients where uric acid levels are high, they will have constant complaint of persisting complaint of irritation in the tongue. Irritation in the tongue mostly is local because of dental problem, some injury happening, some food. But in some cases, uric acid symptoms rise and then tongue is affected. This is called gouty tongue. So now we have a patient. When we look at this data, the ovaries are affected, the uterus is affected, there's a tumor, gout is there, and generally gout and tumor and ovarian region, urogenital region. When you combine this, you come to a fundamental cause, the miasmatic cause in the case is strong psychosis. There's one of the miasm which is there in this patient is strong psychosis. If you have doubt about understanding of miasm, I have made a video on miasm, which Hahnemannian miasm, what he talks about and how simple it is to find out which predominant miasm it is there. So you can watch that video and you can get the answers what I'm explaining here. So here we found out psychosis. Past history and family history. If you have gone through my older videos and if you are reading Burnett, you will find out that in many cases he goes back in the past history and family history, which we have already spoken about. Father and brother died of consumption. 3 times she was vaccinated. You can see again psychosis. When a person is vaccinated, psychosis, the ground of psychosis has been built. Already she's a carrier of psychosis and 3 times vaccinated. Now died of consumption, tuberculosis. So tubercular tendency is also there and also a syphilitic tendency in it. Why? Tubercular tendencies are generally tending towards syphilis, SORA and tubercular, when you syphilis, when you mismatch, like, when we match, tuber, tubercular are said to be syphilis and sora. When they combine, it becomes tubercular. That's how it is there. So you can find a tinge of tuberculosis, tubercular miasm. You can find a tinge of, even because they died of consumption, right? So you can find a tinge of syphilis also. Smallpox, vaccinated, like smallpox, she got twice. And then 2 years ago, had eczema, which was cured. Query. Query is, don't know how it got cured. With Turkish spa or something. What I learned from this is that evolution of disease is very important. Many times patient comes to us with some complaint, and we always focus on present predominant totality, which is always important. It is very important. But it is also more important to go back and trace the evolution of history. Today, the patient has suppose come to you with uterine fibroid, and you want to give a remedy for uterine fibroid. But the first question that you need to ask, why did she get uterine fibroid or Oophoritis? Why did she get this? Hence, it is very crucial to go back in the past and try to find out, you evaluate the diseases, which diseases have come through, and step by step go back and find out all the diseases she has. Because many times what we see, the disease, the organ damage that we see is a result of previous suppressions. So here definitely eczema was there and it was suppressed. So this also gives a small tinge or idea about sora being suppressed. And eczema is always, not always, but most of the time, eczema also can be a part of psychosis. It could be any miasm. I'm just trying to, understand his thinking. It could any miasm. But whenever there is itching, Allen says in his Allen's miasm, whenever there is itching, sora has to be there along with other miasm. So I don't know whether there was itching or not in this patient, but yes, I'm suspecting. I can see multi-miasmatic patient. It's not just one clear miasm. And this is what we find in our cases. We get patients where multi-miasm, multiple fundamental causes are seen. Let us go ahead. So what's the first remedy? The first remedy is, which is the bigger culprit? As Hahnemann said in his chronic disease, the bigger culprit is the fundamental cause. Aphorism number 5, to treat chronic disease, you have to go back and see the fundamental cause. So we see here the full blown, of course it is mixed miasm. You can see a tinge of sora, you can see a tinge of, maybe syphilis, and psychosis is too much. Okay, the predominant miasm is psychosis. So the remedy starts with thuja. So he first treats the fundamental cause, gives thuja. What happened here? Slight discharge from vagina, which is unusual, which is most unusual. He writes, which is most unusual. Why did he write? If you look at the previous slide, the first slide, it is said no leukorrhea. You can see here, no leukorrhea. So she was not, what I assume is that she never got leukorrhea. So for her, after the remedy, when discharge from the vagina started, for her, this was very unusual. Slight shew of eczema on her hands. Now, this is a very good follow-up. What do you think? Right? I think it's a very good follow-up. Whenever you give a remedy and some discharges happen, you should wait. If this was my patient, ideally what I would have done is that I would have waited till the symptoms, maybe it would have gone or it could get aggravated. Then I would take the totality and prescribe the remedy. So what Burnett did here, let us try and find out. Eczema started coming up. Of course, few more symptoms he had seen. And also in the background, like the miasm is there. So he treats it with sora, the antisoric remedy. He starts giving an antisoric. When you read Hahnemann miasm, Hahnemann says that sora is in the background. Like whatever you want to treat, sora is always going to be there. And if you find out any skin ailments, any itching is there, anything which is suppressed, so sora will be needed. In between, you have to keep giving antisorics. So antisorics, the best antisorics are sulfur and soranum. Soranum has got its own picture, like chilly, ravenous hunger in the night, and offensive, body smell. Sulfur has its own symptomatology, burning, standing position aggravates, and so many other features. So you differentiate and you give. Soranum was given here based on totality, and miasmatic approach. Of course, he must have taken totality. I'll tell you, it seems that Burnett was a very, very specific prescriber, but I'm telling you, more and more I'm learning, more and more I'm reading Hahnemann. I'm understanding, that Hahnemann and Burnett, there are many points where they collide each other. Their thinking process collide each other. And Burnett was actually a master of materia medica. He had many remedies which he knew, the pathology, the sphere of action, the indications very well. He was well read about his drugs. Last mentions excessive and painful motions were there. And here he prescribes mercury, mercury. Not much indications of mercury is given here. Why did he prescribe? I also have no idea. But now as we go ahead, you will get the idea why exactly mercury was given. So psychosis was addressed, SORA was addressed. And here I am assuming that if you read mercury, you will find out that there is a lot of dysentery, diarrhea, with a lot of tenesmus and night aggravation. When these components are available, then mercury, the syphilis miasm is predominant. So you can see in the follow-ups, the miasmatic symptoms come up. So whenever the miasmatic symptoms come up, that is a time to actually touch it with the anti-miasmatic remedies. Many times people ask me that, how to give miasmatic remedies, the anti-miasmatic remedies. One way is to understand the past history and family history. But many times I have seen that in patients, the follow-up when you are doing step by step, you'll find out the symptoms are erupting, symptoms are coming of indicating to that anti-miasmatic drug. So I'm assuming because the data is not available, syphilitic tendency, syphilitic symptoms came up, and that's how in the past also syphilis is there, and he gave one. Has globus hystericus and good deal of pain in the rectum. Now, his mercury did not work. Okay. So there are times when his remedies do not work as our remedies. And then he found out a good deal of pain in the rectum. And now here, now this is really good, what I'm going to share with you. See, decoding Burnett, decoding Burnett is not about, finding all the answers, but getting the understanding of his master strokes. One of the master strokes of his personality and his prescription was the remedies that he gave. He had some really good knowledge about the remedies. Now you can understand this patient that we are treating, this patient he's treating. Patient has come for uterine fibroid and ovary inflammation, right? Oophoritis. But you can see, he said that gouty tongue is there, uric acid is there. Means it is a patient of gout. Uric acid is raised. Maybe some kidney function is affected. So psychosis is full-blown in that. Also, there is a trait of syphilis from which he gave mercury. There's some eczema also. So we can give one anti-miasmatic remedy for that, which is a normal way to prescribe. But how about finding a remedy? How about finding a remedy which has all the three of it? And that is what we try to find out when we are trying to find out the totality. But in totality, there are a lot of limitations because repertory has a lot of limitations. If you just try to put all the pathologies and you try to find out, not every case you will succeed. Hence, the knowledge of smaller remedies that is written in boring is prime most important. And here he gives a remedy called Persicaria urens. I had never heard this remedy. But if you see the remedy name, Persicaria urens, like Urtica urens, urens itself means uric acid. Itself means an indication towards gout. Now, uric acid, now you can see Burnett treating a lot of uric acids. So when he was treating a lot of uric acid and gouts, he had a lot of understanding of, he had a huge range of therapeutics, I can say, of gouty remedies. And he knew gouty remedies, not just on their keynote indications, but the way they function in the body, the pathophysiology, the seat of action, the site of action, the range of action that we spoke about in the earlier videos. So now here, let us understand Persicaria urens. If you try to search, it is given in a remedy. Actually, it's a remedy called Polyganum hydropiper. The name is Polyganum hydropiper. It's the same plant and the species. Polygonum punctum. Okay. So polygonum is the remedy. And when you read for Persicaria urens, what Burnett says is that Burnett regarded this as a splenic remedy as useful in old cases of syphilis. So syphilitic tendencies. As a splenic, he found out it was required in cases of gout and gouty eczemas with much irritation. How beautiful it is, how beautiful. It's such a small remedy. You might not be able to understand this, and we will never get it through any repertoire because it is not listed and it is not proved. Hence, it is very crucial when you're dealing with pathological cases. I think we should put a lot of effort to understand, basically decode boring. And decoding boring and trying to understand it from pathophysiological angle is very important. The concomitant, now here you can see this prescription is based on concomitant pathology. What is it? Syphilis, one pathology, eczema, one pathology, gout, one pathology. So he's asking himself, which is the remedy which has got gout, which has got eczema, which has got syphilitic, and all the mixed together. And then that's a remedy called Persicaria urens. This remedy works wonders, has worked wonders. Bowels act better, tumor is smaller, has some irritation of the skin, and she looks much healthier. This is the magic of smaller remedies. All those remedies that he gave was helping, but this remedy did wonders. So it is a follow-up. I always, whenever somebody shows me a case of a good case, I'm not interested in the first prescription. I'm interested in the follow-ups. Because it is the follow-up, when 2-3 follow-ups are done, the physician comes to an understanding of the patient and the remedy, and then his search towards that remedy gets that remedy. And many a times, the small remedies that you come across, it does wonder. But yes, with the caution, because these are not proved remedies. So we don't know how long they're going to act, what is the next step, what are new symptoms that they will take care of. So as long as it acts, you can keep giving it, and then of course, change of remedies required. He repeats. Now it is good, like patient is doing wonders. So what you do is that you repeat it. You don't keep changing the remedies just because the symptoms are changing. So he repeats. December, bowels act freely, much pain in vagina, worse at night. So you can see the syphilitic symptom coming up, right? And here he gives syphilitic. When you don't get indication of mercury, like you're seeing syphilis in the background, but mercury indication is not there. You know the indication of mercury. Salivation, tongue symptom, the sweating symptom, tenesmus, those symptoms are not there. Then you just want to touch, or you want to just address the syphilitic miasm. Only worse in night is there. Syphilinum is a very good prescription. It seems that night really means early morning. Means again after syphilinum also, now here night aggravation still persists, and then he again gives myrrh fibers, because earlier he had given it because of the tenesmus and the rectal symptom, the syphilitic tendency and tenesmus and rectal symptom. He prescribed this. Thinks she is worse, the pain causes her swell. Now even after giving mercury, it's not working. So syphilinum given, mercury given, symptoms remain the same. It's not working. Many times it happens that you give anti-miasmatic remedy, the main anti-miasmatic remedy, and you think, yeah, everything is right, but it is not working. What does it mean? It's not that it is not working. You are correct. The patient needs syphilitic remedy. But along with that, you have to look at the symptoms. Means the 3-4 remedies that we know, like for sora sulfur, psychosis, puja, nitric acid, syphilis, mercury, and syphilinum. These are some general indications given by Hahnemann. But ideally speaking, now you have to give remedies, right? It is a remedy that has given. So when this general indication, therapeutic indication of miasm is not working, it doesn't mean that you're wrong. It means that you have to look into the patient, look in the symptoms, and find out what are the totality, what is the symptom, what are the keynotes, and that keynote mixed with the miasm symptom, find out a remedy. Like you'll find out here. So we need to find out a remedy which is syphilitic in nature. And the patient case, there's a lot of pain, but there is swelling sensation, bloating sensation. And here the remedy comes is bowel scalp. This is an amazing remedy. Bovista, of course, you know, for a lot of condition it is given. Okay, it is given for urticaria, it is given for menstrual complaints, but I've seen used, in fact, I learned Bovista from Burnett because whenever patient says swell out sensation, patient will come and say bloating sensation. I feel bloated, doctor. I feel bloated. The pain caused me bloating. This complaint caused me bloating. Bloating sensation, swelled out sensation. You open Boric, Bovista, mind section. In bold, it is written enlarged sensation. So when patient is saying, see, if he is dropsical, he has ascites, lot of fluid accumulation, then they can say I'm feeling bloated. But there's nothing. And patient is saying I'm feeling bloated. It is not physical symptom, it is a mind. Which remedy has it? Bold and italics. Very important. You read Bovista, it is written in bold. Enlarged sensation. That's how Bovista was given. Feels better. It has done her good. Now, this I just love this prescription. Because syphilinum did not work, though syphilitic. Merck did not work, though syphilitic. Then you go one step ahead. I need a syphilitic remedy with the keynotes and the symptoms matching. So, if people say that Burnett keep prescribing specific remedies, it is not correct. He always looked into the symptomatology also and matched it. Repeated, Bovista continued, then Soranum he gave in between. Has done great deal of good, swelling is decreasing. Then he intervenes with Thuja. Why Thuja? Because psychotic is the base, and also one of the ways where anti-miasmatic should be given is when things are settled down. When things are settled down, that is an appropriate time many times to introduce your miasmatic remedy. Better. Lepis alba, you can please go and look in the video section. Another fibroid video, uterine fibroid, I have made where he gave lapis alba in one of the patient, and I have given an entire description of lapis alba, how to use lapis alba uterine tumor, what are the indication of this. So I'm not going to repeat it here. So please go back and watch the other videos. It's better. Then he comes with silica. Okay. Now I'm not going to talk about, of course, the remedies. Then he gives sternum. Why sternum? Because some acute came in. So he's tackling the acutes. In between, if acutes are coming, he's tackling the acutes, okay, based on totality. Comes and begs to have the prescription, okay, because it did so much good. Means there's a gap, but then again comes and says, please give me remedy. I was feeling so better. Silica was given on indication. Much better. Again, syphilina. Much cutaneous irritation starts. Now, let me read something from Burnett. I'm going to read something from Burnett. You can also go and read this chapter. So what he has to say about this chapter. So in the last prescription, we saw that much cutaneous eruption started. And then he says, then follow hepar, silica, schionanthus, perum, helonius, tarantula, sulfur, thuja. When on May 1st, I prescribed chelidonium majus, and 20th the same month, tumor had so diminished in size that I could find it only with great difficulty. But it required more than another year's treatment before the tumor was quite gone. So it's a long-term follow. And during this time, the changes were rung on the already mentioned remedies and some others, of which two seemed particularly of advantage were urea. So he had given urea, Hecla lava, both of which have more than once done me good service in stubborn cases of tumors, formed particularly in gouty patients. In gouty patients, urea is wonderful remedy. You should sometime. I'm just searching something I've written about urea. I've never seen anybody curing gouts and tumors better than maybe, Burnett. Pathophysiology is so important for this time. Okay, where's my sheet? You have to give me 2 minutes. Yeah, urea. So urea, basically, urea, he gives on low specific gravity. That we all know. We never look at the urine, right? Urine reports. Now there is a rubric. You can find out in many places there are rubrics, low specific gravity, high specific gravity. So we have got remedies for low specific gravity that you will see in the urine test. When you do urine routine, you ask for it, you can see specific gravities. So looking at the reports, you can understand the pathology, what is going around. So low specific gravity, definitely when the urine is thin and low specific gravity, urea is the remedy that he uses a lot in uric acid dialysis. That's one of the ways, basically. Okay. And of course, gouty eczema, it's a nervous tonic, and urea is a tubercular base. That is the remedy understanding you can. So you can try and use this way also. The cure holds good, for I saw a lady quite lately, and this case was rather instructive to me, more particularly from the pathological standpoint. Now comes the most important learning. He says, particularly from pathological standpoint, in as much as eczema had preceded the tumor formation. So if you remember, she got uterine tumor, but before that, there was some eczema which was suppressed. And after that, the, the uterine tumor and Oophoritis came in. When eczema had been got rid of external means, the uterine fibroid began to grow. Moreover, after the tumor had quite gone, eczema broke out again. So reverse, Ehring's law, the reverse, it comes. So when tumor is gone, it has to throw out. The law of cure is from above downwards, more important to lesser important, and inside out. So you saw the first prescription, puja was given and discharges started. And now what is happening is that tumor is gone and eczema has come back. Should you treat the eczema? I don't know. Rather, if I have this patient, I will ask the patient to bear the eczema, not to do anything aggressive with the eczema. Of course, if it is troubling more, I will take the totality and address it. But let the toxins get out. That is the only way the patient is going to get cured. And then he says very nicely, quite number of cases of tumor have their starting point in silenced cutaneous illnesses or discharges. Not many cases of tumor have their starting point in silenced cutaneous discharges. A patient comes with tumor or cancer or any other damages, pathological damage. We try to treat and find out the remedy for that condition, which is very good. You have to find out. But other mind also has to be there, that from where it has come. In many places, you will find out that cutaneous eruptions were there and it was suppressed. So your idea is to get back to that cutaneous eruption. It should come on the body. If it can come back with whatever means, you have done a very good thing. This is no vague theoretical statement, but the fact in the nature which I have often verified, and this is not only Burnett verified, I have also verified in my clinical practice, and many of the clinicians will vouch on this, that skin suppressed and you get to the dreadful diseases, which is clinically verified any day. Many cases of chronic skin diseases are no less than chronic diffuse cancers. Now you don't see much. Of course, there are skin complaints, but generally as the skin ailment comes, they run to the allopaths and they are being suppressed. They become clean, but from inside they become damaged. So skin complaints has to be tackled very tactfully, very skillfully, and get back to the skin. This is one reason why cancer is more common now than formal. While skin diseases are less common, now skin diseases are less common. Cancer cases are so many cancer cases you see in and out. The ordinary dermatologist works unwittingly, great evil, when driving along, whatever. How much mischief did, okay, I will not read this. Okay. And then he says, the last sentence, from there we are done, which I feel we should keep an eye on it. It says, a persistent skin disease in a really healthy taintless person is a sight I have myself never seen. What do you mean to say that? Just as I am not acquainted with any other causeless effects. He says if a person comes to you with a skin complaint, I have never seen a cutaneous eruptions where the taint is not there. What is taint? Taint means the miasmatic things are not there. It has to be tainted, spoiled through the miasm. When that is not there, I've never seen. He says, it means he says that whenever the skin cutaneous eruptions are there, please go back and look for the cause, the fundamental cause. Isn't he saying the same things what Hanuman said in his organelle? You look for the cause. The way of prescription can be different. The way of remedies, the different remedies you can use, that's a different thing. But the philosophy remains the same. So again and again, much I read and learn about burnout cases. I understand that one part we have to read our Mater Medica. We have to find out and search the drugs, maybe the smaller drugs, the bigger drugs. The Mater Medica understanding has to become better. And second part is going back and tracing the fundamental causes, proper use, judicious use of anti-miasmatic remedies at proper time can really be of great help. And we can really together, if follow such a good system properly, we can help so many suffering individuals outside who are there who have no ray of hope in other pathies. So this is from my side. I'm Dr. Manish Yadav from Mumbai, India. Thank you very much. Bye-bye.